Okay, I'm going to do my peer checkoff for inline aerosol, and um, in doing that, I would go ahead and check the order, check the patient chart, and gather any equipment. I've got my T-piece, my expiratory line filter, my nebulizer, and tubing. And I've got pretend medication, and I don't know if you can see this, I don't have a dummy, so this is what I have to work with. But so what I would do is go ahead and wash my hands and put on gloves and any PPE as needed. I would check the wristband of the patient, and then I would go ahead and start assembling my equipment. I would explain the procedure to any family members that are there, and then I would go ahead and silence my alarms and put in my T-piece. So I would silence my alarm. I would make sure I have the inspiratory hose, and while my alarms are silenced, I would quickly add my T-piece. Then I would assess my patient, check their heart rate, breath sounds, blood pressure, SpO2, and respiratory rate. I would check for any contraindications that might be, well, indications and contraindications. I also need to add my filter to the expiratory port so that the medication does not go back into the ventilator. At that point, I would hook up my nebulizer, and it's going to be on 8 liters for the nebulizer treatment. I would get my medication in my nebulizer. I would verify that the medication is the right dose and frequency, and obviously the correct medication for the patient. And then I would go ahead and hook up my nebulizer. And so then I'd be giving that treatment again. It would be set to 8. I would be monitoring my patient the whole time, and if there showed any contraindications during the treatment, of course I would abort the treatment right away. Once the treatment is completed, I would go ahead and remove my nebulizer, shut off the gas, remove my nebulizer, and put it in the bag, the patient's bag, to keep it sterile. I would then go ahead and assess my patient again, also doing all the vital signs and SpO2. I would assess the vent settings, make sure they are set where they are supposed to be. And once the treatment was completed, then I would go ahead and remove my gloves, wash hands, and then obviously any of the closing things we always do, make sure, see if the patient needs anything, or the family, and make sure they have their call light handy. And then I would document the therapy, and if there was any complications or major changes, I would let the nurse know.